Okay, this is Mr. Sipes,
Sipes.
and he is going to give us an update about his stem cell therapy for his shoulder injection, which was done August 2nd.
Right, we're about 3 months out today, and I've come in for a backup amnio injection. In the meantime, I started out with virtually no more movement than shoulder height on both arms. Now I've got upper. I can actually roll it. I've got some torso movement, but I didn't have any of this 3-4 weeks ago. I couldn't do that.
Nothing.
And it's just amazing. And I'm working out at the gym again. I'm in pain the next day. The day after that, I feel great. It's like we're progressing, building a little muscle, and everything's improving slowly. I have reduced margin in the left shoulder, which accounted for constant pain before I came in here. That's virtually gone unless I overwork it a little bit, and then it only lasts a day. The right shoulder is about a 90% improvement at this point.
Mm-hmm.
I'm just amazed. I've been able to go back to working out at the gym, go to the gun range, been doing a little bit of boating, fishing. So all around, my life has improved quite a bit just because of the functioning of both shoulders now.
How much better in the left shoulder?
Left, I couldn't pick it up like this before, and I can actually roll it just like the right, but it hurts. The bones still snap a little bit because of the margin, but the flexibility is 100% better.
Okay, so when you do have pain, you recover quicker?
Yes. One day out, and then the next day I'm fine, and I actually feel a little better because I'm using the joint, and I think the muscle is starting to come back on it because I had so much deterioration from non-use.
Yeah, disuse atrophy.
You're right. I had quite a few knots under my left shoulder blade from using other muscles to activate the shoulder because I had so much pain in here, and the knots have completely disappeared.
Right.
So
you don't use it, you lose it.
Exactly. Yep. And I was relying on other portions of the shoulder and the lats and all that for movement, which I don't do now.
Did anyone suggest a shoulder replacement for you?
No, but that's what I was talking to Lauren about prior to this when I saw her, and she recommended coming down here.
Right.
Because I told her, I said, I'm just about at that point where I'm in constant pain. My tricep was just contracting constantly. I would sit here, watch the TV at night, my arm would lift up involuntarily, it would just jump. The nerves were getting to that point.
Right.
So, and I was definitely considering it.
Yeah.
But
so we used the umbilical cord blood stem cells, and we did 1 cc in each shoulder,
right.
And that was in August. And the injection with our nurse practitioner is great. I mean,
oh, absolutely.
There is a difference between different people who inject. Some are better than others.
Absolutely.
Lauren is phenomenal.
She's excellent. Yeah, no pain involved with the injection.
Nope.
Or afterwards. It was just a great experience all the way around. And then 2 weeks later, my pain had dissipated to the point where it was really not noticeable unless I had done an awkward movement to stimulate it. So
again, how long? Refresh my memory. How long had the shoulders been bothering you?
I have had problems since 2008 is when it started.
Right.
Actually, and then I had a motorcycle wreck which created a whole situation back in 1975 with a compound fracture in the right arm. The shoulders received damage on both of them, and it compounded from there over a period of years from working. So
2 weeks within stem cell therapy.
No pain.
No pain.
Yeah, the pain was just virtually gone. And
had anything else prior to stem cell worked that efficiently?
10 Advil a day. 10 or 12.
A day.
Loading blocks of cam, sometimes 2 of those on top of the Advil. Right. Definitely not the road to go down.
Yeah, so you can't keep doing that.
No.
No.
I was worried about stomach and intestinal degeneration, and I've talked to people that have done that without enough fluids and had problems and have gone in there and had intestinal surgeries from this stuff laying in there dormant.
Right, yeah, they're not made for long-term use. They're great for short-term use, but long-term, and then some of the NSAIDs can raise your blood pressure with time.
Right.
So we don't want to do that. So great, yeah, I mean, this is a new frontier, these stem cells, and
I'm amazed. I'm really happy I've been down here and met you all and gone through this to now, and I'm looking forward to it because I figured I've heard about 6 months out is really where you've got a threshold of a higher point of recovery.
Right.
And now with the amnio backing that up at 3 months, I really think it's going to make a heck of a difference next year. But,
all right, thanks very much.
Yes, sir. I appreciate it. Thank you.
You're welcome.